Guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. Black and the white terminologies. This is in case of the radiology. So what is black and what is white? So black in case of X-ray. So first let's look at X-ray. So what is black in case of X-ray? So we are just looking at the black color. So X-ray, it is air. The air that is radiolucent, it appears black. Then moving on to the USG, it is hypoechoic. That is anechoic. So it is hypoechoic. This is again black. Then moving on to the CT, it is the hypodense. The CT is hypodense, as well as the MRI, it will be hypointense. The MRI will be hypointense. The MRI is nothing but hypointense. Now let's move on to the white. So under white, what is the X-ray? The X-ray, it appears radio opaque. So it includes the X-ray, it appears radio opaque, that is the presence of the bones. Then moving on to the USG. The USG, it appears hyperechoic. The USG, it appears hyperechoic. And moving on to the CT. So what happens in the CT? The CT is nothing but it is hyperdense. Then moving on to the MRI. MRI, it is hyperintense. So everything is hyper in case of it is white, it is hyperechoic, dense as well as intense. Whereas in case of black, it is hypo for all. Now moving on to other important findings, that is in case of consolidation, the air is replaced by something more dense. So air is replaced by more dense. So air is replaced by more dense in case of consolidation. Now looking at the consolidation. The consolidation, it appears white on X-ray. It appears white. This is present on X-ray. And when you look at CT, the CT is based on the electron density. So CT is based on electron density, and here it is nothing but the HU. So what is meant by this HU? So HU means it is nothing but the Hounsfield unit. The Hounsfield unit. So this value. So the higher the HU, it means the higher is the density. The HU value, if it is higher. So this basically indicates that the higher is the density. Next is the fat is hyperintense in the MRI. The fat is hyperintense. This is in case of the MRI. So both the T1 and the T2 weighted MRI. T1 and T2 weighted MRI. Now looking at the bones, the cortex and the ligaments. So all these are nothing but hypointense. So the bones, cortex, fibrosis and the ligaments, they appear hypointense. That is, they have the T1 and the T2 weighted MRIs. So T1 and the T2 weighted MRIs. To learn and grow daily like this, please do subscribe.